Mandibular anatomy on partially edentulous condition. Mandibular anatomical reference, you always start from pear-shaped pad. This is located right in this area. And so that's always the first reference mark that you need to identify when you're looking into the mandibular arch. Start from the pear-shaped pad. The first outline form that you need to focus is buccal to the pear-shaped pad, which is forming right this line. So curve of S shape, and this is called M plane. The reason we call the M plane because this is the area located to right next to the buccal masseter muscle. Therefore, we call M plane. And this is one of the critical shape that you need to focus on when you taking impression and making removal prosthesis later on. Next to the M plane is called around this wide flattened good surface, and this is called the buccal shell or B curve. This is the area that has a primary stability for mandibular denture. Next to the B curve or buccal shell is B and I plane. It's bicuspid and incisor plane, and or some people call buccal vestibule and incisor vestibule. So the buccal vestibule, incisor vestibule consists of B and I plane. And next reference is on the lingual side. So the lingual surface of this floor, which is the floor of the mouth, this is called F plane, and another name will be lingual vestibule. So this entire surface we call lingual vestibule. And then for the mandibular, you also need to identify the frenum and vestibule. And there is a lingual frenum area and maxillary labial frenum area and buccal frenum if it's present. So labial vestibule, buccal vestibule, and of course this is posterior alveolar ridges. And the last one will be connecting area right in this section, most distal lingual side. So we call the F plane, and connecting from the end of the F plane to pear-shaped pad, connecting from this toward to the F plane, right this line we call PG curve. Palato-grossus curve is called the PG curve. Mandibular fully edentulous anatomy. So mandibular edentulous anatomy and anatomical reference, you always start from the pear-shaped pad. So this pear-shaped pad is located right in this area. And this is the first reference point that you always need to look for mandibular impression. And then the next reference mark we call M plane. which is right next to buccal side of pear-shaped pad, so which is located right in this area. So buccal side of the pear-shaped pad and coming in. So this shape called M-plane, the reason we call it M-plane because it's area next to masseter muscle. And M-plane, and the shape is extremely important, especially for retention of mandibular denture. The following reference mark is on this area right here, and very wide flat lesion right here, and it's called the buccal shell. Another name, buccal B curve, buccal shell or B curve right here. The next plane is buccal vestibule, labial or incisor vestibule, or B plane, I plane. So that's including buccal vestibule and labial vestibule. And then going to the lingual side, on lingual side of this lingual vestibule or F plane. This F is the floor of the mouth, and then initial F we call the F plane on this lingual vestibule right here, from here to here. Once you identify the vestibule, then you need to look for frenum too. On the mandibular lingual frenum, so it's entire area on this part called the lingual frenum. And then this particular patient is show very prominent buccal frenum and then labial frenum location right in this area. And of course, this is posterior alveolar ridges and this is anterior alveolar ridges. And the last reference will be connecting F plane or lingual vestibule to mesial of pear-shaped pad. And once you're connecting from F plane to pear-shaped pad, this line we call PG curve, palatoglossus curve, PG curve line. That will determine distal lingual outline form of mandibular edentulous ridges.